Assalamu alaikum, hello and welcome to The Health Show, here only on the Islam channel with me, Alistair Greener. Every week we're joined by a health expert within their specialist field and discuss the prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, The Health Show offers an alternative viewpoint from our health experts who attend the show to help guide you in the right direction. If you'd like any further information on our programme or any of the topics that we discuss, then please do get in touch at healthshow@islamchannel.tv. Now today we're going to be looking at the NHS Stay Well Pharmacy campaign. Public Health England has just launched a campaign using TV advertising and posters. Now, the reason for this is to encourage people to use their local pharmacy as a first port of call for minor health concerns. Running from the 12th of February to the 31st of March 2018, the campaign aims to increase the public's trust and confidence in community pharmacy teams as the place to go for clinical advice for minor health concerns, rather than visiting their GP or A&E. And to tell us more, it's great to welcome pharmacist Mary Owaya to the show, who's going to discuss the campaign with us. Mary is a community-based pharmacist who is very much involved with empowering patients and their carers to give them longer life by staying well. Mary, thank you so much for coming to the show.
Assalamu alaikum.
Lovely to see you, and lots to talk about, which we'll do in just a moment. But first of all, let's talk about your local pharmacy teams, who are healthcare experts that can offer clinical advice for minor health concerns, such as sore throats, coughs, colds, tummy troubles, teething, as well as aches and pains. A quarter of people feel it's difficult to discuss health concerns in private with a pharmacist, with many not being aware that, in fact, more than 9 out of 10 pharmacies actually have a private consultation room. Let's take a look.
Morning. How can I help?
I'd like to get some advice on my daughter, please.
Follow me to the consultation room.
Thank you.
If you or your child has a minor health concern, the first place to go for advice is your local pharmacy. We're healthcare experts who can help you with things like coughs, colds, tummy troubles and teething, right there and then. And if your symptoms suggest it's more serious, we'll ensure you get the right help. Your pharmacy team, we're here to help you and your family stay well.
It's great to have you on the show, and it's really fascinating looking at this campaign, because with the campaign that you're running at the moment, this is very much about getting people into their pharmacies. And some people might not actually really understand what a pharmacy is and what it actually does. So let's start with the real basics. Okay. What actually is a pharmacy?
Well, a pharmacist is an expert in medication. So what we do in our role, we assess prescriptions when they come in. We support patients with their long-term conditions. We explain to patients how to take their medicines when they first start. That's new medicine services. We support patients in the various ailments they have. We help and give advice over the counter. We assess clinical needs. And we also signpost patients to their the GPs or places where they need to go.
It's quite interesting, because a lot of people, their only encounter with a pharmacy will be that they've received a prescription maybe from their doctor.
Yes.
And they go along and they collect their prescription. And many people won't be aware of all of these other things that you mentioned. Yes. That pharmacists actually do. What are the most common misconceptions that people have? What do people actually often not realise that a pharmacist does?
A lot of people actually don't realise that we actually go to university and get an education about medicines. There's a lot we actually do in the pharmacy profession. A lot of times, because we're in a shop on the high street or in a retail part, a lot of people think we just dispense the medication. But as pharmacists, we actually assess to make sure the medicine is right for the patients and the dose is accurate. We also support lifestyle changes as well to ensure people do live well. And we run health initiatives organised by the government, things like supporting blood pressure monitoring, flu, vaccinations, stop smoking, and lots of other things to help you stay well in the community.
Now, this campaign is all about getting people to treat the pharmacist as the first port of call,
Yes,
the
that's
first
right.
place to go.
Yes.
You know, we hear a lot of stories in the news about people going to their GPs, maybe having difficulty getting an appointment, then they turn up at A&E,
Yes.
where in fact I think what you would suggest is that so many of these times that's not actually necessary. A pharmacist will be able to answer some of those simple questions. So what are some of the sort of simple questions that people might panic, go to the GP or A&E when in fact you're perfectly able to assist?
Yes, with our experience, we have expertise on medication and clinical conditions. So we are actually easily to access, where most pharmacies are about 20 minutes walk for most people where they live. So we don't need to book an appointment. You just come in and we're a friendly face. We are there and we are quite knowledgeable and can support in most conditions.
I mean, not having to wait for an appointment that's going to be a major plus for most people.
Absolutely, yes.
And the fact that people can maybe do it, you know, during their lunch hour, they can do it
Yes.
on the way to work, on the way back from work. That convenience must be something that's really, really positive for people.
Especially after hours as well. When you finish work, some of the pharmacies are open longer hours, so they're readily accessible at all times, especially when the GPs are actually closed as well and you're panicking.
One of the things that people often think about when they're maybe in a slight panic because they or their child or someone in their family isn't well and they want to go and see the GP or doctor straight away, and they worried that maybe going to the pharmacist they're not going to have sufficient knowledge to be able to help them. You talked a little bit there about the education and the training that
Yes.
pharmacists get. Tell me a little bit more about that and how detailed it is.
Okay, we are trained in all illnesses, medical conditions, so we are able to identify red flags. Red flags are signs whereby if it's not a minor condition, which we usually treat, we can refer on to the appropriate hair care professional, be it the GP or to A&E. The important thing about this campaign is letting people be aware that on the high street or near just 20 minutes away from you, you have healthcare professionals that can actually prevent you from going to A&E when a lot of the conditions are self-limiting and would go anyway. So,
What do you mean by self-limiting? What does that mean?
so especially with children, most of the childhood illnesses are what we call viral. So over some time, when the child first presents with the symptoms, most parents tend to panic, and that's why they rush to A&E. Sometimes all the parents need is reassurance from another healthcare professional to know what to do to manage those symptoms without necessarily having to see a GP.
One of the things that I'm familiar with, that when you go to A&E or something, you see a triage nurse, and,
Yes.
and that's the nurse who will assess you initially
That's
to
right.
see what course of action, where you're going to, who's going to see you, how, etc. Is that a similar kind of thing that you're doing effectively when people come and see you at a pharmacy? Is that you will take that initial view
Absolutely.
to decide what to happen next?
Absolutely, that's exactly what we do. We have the ability to be able to assess and decide whether it's something we can manage in the community or if it warrants being referred on.
And that's something to really stress, isn't it?
Absolutely.
That some people might think, actually, this is borderline, I'm not too sure. Immediately, a pharmacist will be able to say, actually, this is something you need to see your GP, or you do need to go and see
Yes.
A&E. This is not something we do. And people can have absolute faith that the GP or A&E will be able to see them, but more importantly, that decision will be a good decision from a pharmacist. Because
Yes.
I'm guessing some people need a bit of reassurance with that.
A lot of people need reassurance, especially first-time parents. You know, when the child is unwell, the first thing you want to do is tend to panic. And it's always good to have somebody you can easily get to, easily accessible, to reassure you that things are going to be okay.
We saw there in the video about these consultation rooms, and I must admit, I know a little bit about this from the show and everything. I had no idea that you could go to your local pharmacist and you could actually then go and have a private consultation.
Absolutely. Almost 90% of pharmacies now have a consultation room, and it's designed to have private conversations, because a lot of times people come in with embarrassing conditions and they don't want to talk about them over the counter. So yes, we do take a patient to a side into a consultation room to have a private conversation.
And that's particularly important for women, I know, and certainly for the women in the BAME community who feel very strongly that they need to be discussing this with another woman
Absolutely.
in private.
Yeah.
So the fact that that's available, I think, will probably come as a surprise for lots of people.
Yes, a lot of people are not aware of what we actually have in the pharmacy.
Now, you obviously have limited time because you can't spend ages with people because you've got other people trying to get their prescriptions, get help and so on.
That's
so
true.
typically, how long of consultation would you be able to give people?
Well, the time of the consultations vary because we always try and put the need of the patient first. And it's also important to recognise that in the pharmacy, we have a pharmacy team. So it's not just the pharmacist. We have pharmacy healthcare technicians as well, which support the pharmacist. And the pharmacy technician also are experienced and trained in minor ailments, and they're able to support various roles and various services we offer.
And the great thing is, of course, if anything is diagnosed there and then, you've got the medication available to be able to, hand over the counter there and then. So effectively, people will be able to get treated almost immediately.
Yes, it's very important to emphasise that we manage conditions and we treat, but we don't make diagnoses. We manage minor ailments in the pharmacy, because as pharmacists, we don't make diagnoses.
That's a really good point to make.
Because we're not doctors. No.
So in other words, if you still needed a prescription, that still has to be done by your doctor.
Absolutely, yes.
So this is more to do with minor ailments where actually you don't need to go as far as having a prescription. Actually, this over-the-counter medicine or treatment will be just as effective.
Usually suitable, yes. In some cases, some pharmacists do actually go on to do extra training and they actually become prescribers, but there are very few of them that are doing that at the moment. But it's important to check with your pharmacist the area of expertise and how far they can help you.
I think it might be really helpful to get an idea of the type of things that people will come and see you about and that they can see you about that they maybe didn't realise. We're going to talk more about children and young people in the second half of the show.
Yes.
So when it comes to adults, what are the typical things that people do come to see you for, and what are some of the things that they could come to see you for but don't realise that they could?
Well, coughs and colds are the very common ones we get, especially around the winter. Hay fever, stomach aches and pains, those are the main minor conditions. But even other things where people are not too sure, there's nothing medical that we do not look into because we actually incorporate that into our training. The various services we also help run. We help the government to achieve their targets, especially with stop smoking. We run stop smoking clinics. We measure blood pressure. Sexual health is a big role we play with looking after morning after pills, erectile dysfunction. The various services there, which are usually the kind of areas that people don't really like to talk about. But
hence why the consultation rooms are so good.
But it's there for people to come to the pharmacist to speak about. We also run campaigns as well, government campaigns, just health awareness campaigns, projects to enlighten people of ways to live well, diet, exercise. So many campaigns that the government run, we carry them in the pharmacy.
Now, just a couple of real basics about pharmacies. You don't need to register with a pharmacy like you do with a doctor, I presume.
No, we don't.
And you don't seek ID or anything like that from people because it's just basically an advisory service to then offer any minor treatments.
But we do encourage loyalty. We do have regular patients that have long-term conditions where we support their long-term conditions, and so we review their medication after so often. So as much as you don't have to register like a GP, we do encourage loyalty, that you go to the same place so that you have a consistent information on your record, and so we can monitor if you're buying things that can clash with your medication. It's very important, especially around the winter when people are buying medicines for cold and flu, the medication that can clash with their prescription medication. So it's very, very important.
So it makes perfect sense to have that continuity.
Yes.
And I understand that for some people, maybe with limited mobility, who find it difficult to get out of the house, there are sometimes services that can actually help them in terms of delivery or things like that.
Yes,
Tell us more about that.
So we have, especially for housebound patients that can't come out, or if you've had an operation and you find it difficult to access your local pharmacy, we offer services like delivery services, and some pharmacists actually do visit at home to see how they're getting on.
Let's look at the actual campaign itself.
Yes.
This is clearly a very positive initiative that's coming through that's going to save probably the NHS quite a lot of money, because it means people aren't taking up valuable time with GPs and A&Es. But actually for the patients themselves, for us as a general public, it's a great service, isn't it? It's something where we can really benefit. Tell me more about the campaign and how the campaign's working, and again, repeat some of those key mission statements, if you like, that you really want to get across.
It's very important, especially at the weekend, out of hours, that the public are aware that you don't have to rush to A&E all the time. If your child's not feeling well, a local pharmacy will be able to help. What's happened with the campaign, we're finding a lot of people that come into the pharmacy first, and they're finding that they're being helped in the pharmacy and they don't actually need to see their GP. They're very grateful that the minor ailments are looked after, the child is well, and they didn't need to go.
And I guess a lot of it is try it once, you'll see, and you suddenly think, oh, actually, they know rather a lot, they can really help with this. So I suppose it's getting people in the habit of doing this.
Yes, and it's spreading word of mouth as people have experience, and a pharmacist looks after the child, they tell their friends, and these days with social media, people post things about their experience with their pharmacist, and then it cottons on. So things are changing.
And actually, it's interesting you say how our perceptions as a general public is changing. Have the services actually changed that much recently? Is this fairly new, this idea, or has it actually been around a while? We just haven't been aware of it.
It's been around for a very long time. It's just that a lot of people haven't been aware of all the various services we do. So now that there's so much pressure on the GPs with the waiting times and the A&E, it's being emphasised now and made publicly aware, so that those conditions that can be sorted out by the pharmacist are sent to the pharmacist without going to the GP and taking up valuable time.
And again, it's the real message to get across is the fact that we're talking about an assessment to see whether you need to go any further, because if you don't need to go any further, actually you've just saved yourself a huge amount of time.
Absolutely.
Now, with a pharmacy, we normally see them incorporated in other buildings as well, don't we? We see them, for example, in some of our big supermarkets and things like that. Is there any difference between one pharmacy and another in terms of the service you're going to get and the facilities that they have and what they can offer you?
Well, depending on the space and the setup of the pharmacy, they will offer various services, but fundamentally, most of the services that patients need, especially out of hours, clinical assessment, will be in each pharmacy.
For the general public who are still maybe a little concerned, thinking, I'm not completely convinced, what would you say to them to convince them this is a great idea, you should really try it?
I think you should take a little walk to your local pharmacy and say hello to your pharmacist and see what they do. Introduce yourself, come in and have a look.
What a great idea. So you don't actually need to have an ailment, just pop in.
No, just pop in
and say
and say
just
hello.
in case something happens.
Absolutely. What can the pharmacist do to support? Just your friendly pharmacist, someone in the community. So you can just talk about, you don't have to be ill. We would also encourage you to stay well. Diet, exercise, general health.
Let's talk a little bit about that, because you mentioned that earlier on about some of these other services, again, that many of us won't realise that the pharmacist does. And these are sometimes things that we might find that we end up speaking to the GP or the nurse at our surgery or something. But actually the pharmacist can help us. What are those extra services, and perhaps go into a little bit more detail when you talked about, say, diet and nutrition and more preventative health care?
Yes, the flu vaccination was a very common one, which the pharmacies have been running just before winter. So that's a service where you don't have to be registered with a GP, but it's preventing you getting flu. So it's an absolute vital service that we run in pharmacies just before winter. We support people to stop smoking. We encourage people to live well. You've got a range of dietary plans that we can establish with you. We have one-to-one chats to encourage you and support you in whichever way you want to go, be it encouraging you to stop drinking, drugs. So many things in the community that you're worried about, or should I talk to my GP, or not too sure, come to the pharmacist first. If you're not sure the pharmacist can help you, the pharmacist will definitely signpoint you to the right person.
And that is, we've mentioned it more than one occasion already in this interview, but it is really an important element to make sure that people realise that what a pharmacist can do is limited. but beyond that, they will always refer.
Absolutely.
Will they have the knowledge of who to refer you to?
Yes, absolutely.
If somebody came to you with maybe a skin condition that they were a bit uncertain about, it's something that they hadn't seen before, and we've talked a lot on this show that you should always seek a health professional when you detect something different in your body. Whether it be skin. But let's talk about skin for a second, because that can be something from just a minor irritation to something more serious. Again, you would have that knowledge, do you?
Yes, we actually stock a various variety of creams in the pharmacy which can help with eczema and various skin conditions. So as a pharmacist, we will look at it and assess and decide which medication is appropriate. Now, if it's something that is being used or has been for a long time and the pharmacist has supported you and it's not going, the pharmacist will recommend you go to your GP or go to a dermatologist where appropriate. And in lots of cases, the condition heals, and so that extra visit to the GP wasn't necessary. And that's what we're trying to emphasise.
I'm going to put you a little bit on the spot here, because as a pharmacist, you see everything.
We see everything.
And obviously the same level of confidentiality is maintained by you as anybody in the medical world. Without going into too much detail, what are some of the things that have surprised you that people have come to you to talk about that you actually were able to help them with, and they maybe thought it was going to be something that they were going to have to go to A&E or the GP for?
There's nothing we don't talk about in the pharmacy. We maintain confidentiality, be it, you know, piles, things below that people don't want to talk about. They're very embarrassing to even discuss with a GP. That's the reason why we have the consultation room. A lot of times people don't want to talk to the GP about certain things. So as a pharmacist, we will share and talk about the condition and point them and emphasise if they need to seek extra medical help, that they need to go.
From a legal point of view, say, for example, we're going to talk more about younger people later, but let's talk about maybe carers. You know, people, for example, who maybe come in for an elderly relative or something like that. How does that work when maybe the elderly relative can't come in, but it's somebody speaking on their behalf or something like that? How that obviously then becomes a little bit more complicated. Well,
confidentiality is very important in all area of medical science. Without consent of the actual patient, unless the carer has power of autonomy, you cannot discuss someone else's medication with a carer.
And obviously, again, when you've got carers, you've got medical professionals who will be looking after vulnerable people as well.
Absolutely, yes.
And they can come and report and to maybe get some advice as well.
They can come in for advice, but confidentiality is very key in pharmacy as well. The same rules that apply with your GP apply similar in the pharmacy. We're not allowed to disclose to another person other than the patient themselves.
I think the main message that's coming across here is trust your pharmacist.
Absolutely.
And go and see your pharmacist.
Definitely.
We've got lots more to talk about in the second half of the programme, particularly talking about youngsters as well.
Yes.
But in the meantime, we must stress that should you suffer from any medical problems or have any health concerns whatsoever, it's highly recommended that you contact your doctor or GP, as the Health Show offers an alternative viewpoint to the health concern being discussed. Now it's time for a short break, but as I mentioned, we'll be right back with lots more to chat about, so don't go away. Welcome back to the Health Show, where our topic today is the NHS Stay Well Pharmacy campaign. As you may know, your local pharmacy is the place to go to get any prescription medicines and clinical advice for minor health concerns. But they do a lot more than that. As well as helping with common illnesses like sore throats, coughs, colds, tummy troubles, as well as aches and pains, pharmacy teams can also help with stopping smoking, cutting down on alcohol, advice on safe sex and emergency contraception. Many pharmacies are open till late and at weekends, and you don't need an appointment, you can just walk in. Pharmacists should be the first port of call and may also be a choice of a professional, according to this clip.
It's playtime and the kids are deciding what to play. Step aside, astronaut, the pharmacist is in town. Qualified and ready to deliver expert advice.
I want to be a doctor. I want to be the doctor. I want to be the pharmacist. What's a pharmacist? No, pharmacist. They're highly trained healthcare professionals. They offer advice, private consultations and medication. They help with minor health concerns. Why wouldn't you want to be a pharmacist? Ah, I want to be a pharmacist. Me too.
It's another day in the Jones household, and Dad learns that pharmacies are the first place to go for parents if their child has a minor health concern.
Max has got horrible tummy troubles. To the doctor.
No, we'll pop to the pharmacist. Pharmacists are the first place for minor health concerns, such as coughs, colds, teething or tummy troubles.
Oh, great.
It means that we can look after Max and be back in time to feed the other kids.
A cold has hit the Smith family and all the kids are laying low. What will Mum and Dad do? No appointment needed, pharmacy team to the rescue.
I feel so dreadful. It's likely just to be a cold. I'll pop to the pharmacy for some advice. No, it needs to be a doctor. The pharmacy is just around the corner. I can go and see a fully trained healthcare professional. No appointment needed. That's it. I've been going wrong all these years. All these years, and he's only 5.
That was a great video, and there's nothing better than seeing young people to actually reenact something that probably does happen in every household every day. Yes. One of the things that people will often be concerned about is the most vulnerable in our society, which is the very, very old, but also the very young. And when you talked earlier on about people with maybe newborns, with young children, they become very protective. Yes. And it was great to be able to see that it was really important that actually people do trust the pharmacist. What are the typical kind of things that a parent might either bring their child in for or talk to a pharmacist about?
So very common things we have in the pharmacy: coughs and colds, high temperature, rashes, and especially children under 5. A lot of the childhood illnesses are viral. And once a mum sees a spot, the first thing is to panic. Oh my gosh, what could be happening here? So most of the times, a lot of times, especially at the weekend, we have parents come in with their child crying, with a rash, high temperature, and it's trying to assess what illness the child actually has. And with all the media, a lot of times parents worry about sepsis and pneumonia and meningitis. So it's always good to have a healthcare professional see the child and make sure what it is. If it's something we've checked and we've found out that it warrants medical referral, we will definitely refer the child. The other day I had somebody, a little child, that had a rash. The mother had tried to treat it and it hadn't gone. And when she brought the child to the pharmacy, it was actually shingles. I was surprised to see myself because it was a young child, but I sent the mum up to the GP and the child was given an antiviral. It was shingles. She was so grateful.
Well, that's what really strikes me, is the fact that you can find out something so much quicker if you go to a pharmacist, because by the time you get the GP appointment or by the time you get seen at A&E or wherever other route you might take, you've actually now built up even more worry. Yes. So to be able to have your mind put at ease, because I'm guessing a lot of the time, or a huge amount of the time, actually it's pretty innocuous what might be wrong with this child. Yes, absolutely. But you can put people's fears at rest. Yes. It's very important to be able to reassure, especially new parents, what is going on with the child. And a lot of times we provide those things you need to help the child and help the symptoms, and the symptoms go away. So many times we've had parents come back and they pass on the word, "Oh my God, thank you for saving my child. Thank you for being there," you know, or they would have had to go. And sometimes you can't even get an appointment with your GP. You ring up and the receptionist says, "No appointments available till a week." What do you do? So it's best just to come to the pharmacy first and see if we can help. And then you may not actually need that appointment with a GP. And absolutely, because quite often when people can't get the appointment at the GP, they then head off to A&E. Yes. And that's, you know, a long stay waiting to be seen, where actually by seeing your pharmacist, they'll say whether or not you need to make that trip to A&E or not and save you the time. Absolutely. And the thing with what we do with the assessment is that if it's something we can help, we will help, and you may not necessarily need a GP or A&E. But then again, if it's life-threatening, there are red flags, we will send you to A&E. What we tend to do, rather you ring 111, because sometimes with the 111 they can actually get the ambulance to take you into A&E
instead of sitting there for 4 hours. So there's so many ways to support the system now so that people don't go to the wrong place first. There are other aspects in the community you can come to, like the pharmacist, which we save so much time and avoid unnecessary appointments.
Now, it makes absolute sense to me. I'm buying into this 100%. I'm definitely going to be going to the pharmacist in future first. What about those who are yet to be convinced? What are the typical things that are holding people back? You mentioned lack of knowledge, where they just don't know. Are there any other reasons that might prevent people from considering their pharmacist first?
A lot of times people are generally well, so they've not had any reason really to go to a pharmacy unless you're buying makeup or buying sanitary, other things. But I think it's a good idea if, take a walk into the pharmacy, get to know your local pharmacist. Your local pharmacist is part of your community. You can develop a rapport, ask about general well-being. You can pop in and have your blood pressure taken, for example. Talk about diet, exercise, things you want to just go and have a conversation, get to know your local pharmacist.
But that's one of the things that also does cross my mind, is that for many people, and especially youngsters, going to a doctor's surgery or going to a hospital is quite a daunting and sometimes even frightening experience for them, if it's that leap into the unknown. And if you're just going to your local pharmacist, I can imagine actually that a lot of those barriers are broken down immediately because it's a far more relaxed environment. Absolutely.
If you're going in to get your toiletries, for example, pop in and say hello to the pharmacist. Just look at the services they offer, so that time you do need them, you know where to come. And it won't be so daunting as well. It's easy, accessible. You just walk in without booking an appointment, and then you get to be comfortable with what your local pharmacy can offer.
And also, of course, you can explain to your children as well, so that they're familiar with that environment. Are there any other reasons why people might not go? Let's say they've seen this campaign, they've seen the adverts, and for some reason they're still not going. What could they be? What reasons could there be?
A lot of times people are not aware of the training pharmacists have. As pharmacists, we go to university and get we spend 5 years at university, and then we spend a year under supervision with an already qualified pharmacist. And our pharmacy technicians as well are trained in medication as well and supporting conditions. And we're also trained in things to help you live well in the community. So it's not just about being ill as well, it's about staying well. And as much as the primary fundamental education, each year we do continuous professional development, so we're always learning new things come out, we're there to know what is available.
And that's particularly important when it comes to children, especially when there's new strains of flu and so on. This campaign has been very heavily targeted towards families and children. Why is that?
Right, because most of the times when, as parents, we panic, there is the vulnerable people in the society, both the young and the elderly. And they're the ones that make you panic first, and you think, oh, what can I do to help this vulnerable person? And what we want to emphasize is that instead of worrying about going to A&E or worrying they can't get an appointment, they know straight away they can easily get access from a medical person who can actually look and see the symptoms and decide with you if this patient actually needs further medical intervention. It's just being able to have a second opinion straight away, easy access. I think that's what the campaign is trying to get across.
Now, so there are some people who would say, actually, you know what, I know my child, I know this is going to be something I definitely have to go to an A&E for. That's obviously a tough decision for anyone to make, and you tend to go for the default of, I know that absolutely for sure in my mind, and you can do that. For you as a pharmacist, what would you say to those parents who, are so determined that actually, no, this is what I've got to do. I've got to go to the A&E, I've got to go to the doctor because this is that important.
Okay, for those parents, it's very important to realise that when you go to A&E, you have at least about 4 hours waiting time. During that time, you could actually be there picking up other infections with the child. So you don't want vulnerable people to be sitting in an area where they're picking up more germs. And a lot of times as well, because the pharmacists are trained in medical illnesses, we are qualified to be able to let you know if you do need to go on to A&E. A lot of times, some of the conditions, the studies have shown that most of the conditions that after waiting 4 or 5 hours in A&E end up to be things that could have been treated in the pharmacy. So
let's talk about some of those typical conditions maybe that you feel are something that can be pretty easily solved by a pharmacist, but is something that quite often people will go to the GP or A&E for.
The very common one is the virus, the common cold, influenza, anything to do with viruses. People get high temperature and they feel unwell, and the first thing they want to see is the GP. A lot of those things can be resolved after some time, and all you need to do is manage the symptoms, and that's where the pharmacist comes in, because most of the items given can be sold over the counter. We don't advocate you use antibiotics straight away. Viruses are not treated by antibiotics, so it's very important that the symptoms are managed so that your immune system is actually built and got stronger, instead of going to vulnerable places where you can pick up more germs. What we want to try and avoid in our community is getting more germs into the system, and we want people to stay well. The whole idea of the campaign is that people stay well, and rushing to the doctors and rushing to the A&E sometimes just brings in more bacteria and infections into the community, so it's a vicious cycle.
We talked a little earlier on about tummy troubles, and
yes.
Again, that's a big one for children, and sometimes it's a little difficult to determine what's actually going on. Is it food poisoning, is it a bug,
yes.
or whatever? In your experience, what kind of cases have you seen where actually you've been able to help?
A lot of the gastroenteritis are viral. Sometimes it could be food poisoning. So we do ask questions. We do get medical history, patient history, and we do listen to what's been going on. So we are able to gather information and be able to help the patient at that time of need and make an assessment.
Now, you work particularly with children and vulnerable people in society. How are you getting on with convincing them that actually the pharmacist is the best route to take?
So the area where I mainly practice, with the health authority, we've worked together with the GPs, local GPs, and we've run workshops where we empower patients, especially parents, carers, of the first steps to do in an emergency or when a child is ill. We found them very, very useful, because what happens is that the GP goes through the common childhood illnesses, tells them the symptoms and what to look out for. As a pharmacist, I tell them about the various things to stock well in the house, to have there, just in case 2 o'clock in the morning is usually the time the child wakes up crying with a high temperature. So it's good to have things like Calpol or paracetamol or ibuprofen already stocked in the house, so that there's something to administer straight away. And we always encourage that the patient or the carer or the parent is calm, so that you're observing the child. Because a lot of times when the child is unwell and you're panicking and rushing around, the child is responding to you, the panicked parent. So these workshops try and empower patients so that they are looking carefully at the child and actually identifying what's going on. And if they're a bit confused, and because of the state of the panic, going to the pharmacist is usually the best first port of call to get a second opinion. And if the pharmacist identifies, look, this is more than you think, they will refer you on to the next appropriate place. So the workshops have been really good, because instead of just thinking A&E first now, parents actually look at the child, observe, get a second opinion from the pharmacist first before they even think about the GP or A&E.
There's a massive advantage with pharmacists being open the long hours that they
yes.
are. But you talked there about that 2 o'clock in the morning, the child
yes.
wakes up crying, got a bit of a fever. What do you suggest parents do if it's 2 o'clock in the morning? I presume you probably wouldn't advocate going to Dr. Pedia.
No, absolutely not.
And checking all of that. So what would you suggest in those sort of situations?
There's a service as well, what NHS is running, which is the 111 service, immediate access as well. So around 2 o'clock in the morning, if the child has a high temperature and you've administered the appropriate medication and you're still concerned and you want to speak to somebody, call 111. That's an NHS service that's available as well.
And what could they typically do? I mean, are there special pharmacists that will stay open all night, like an emergency pharmacist? Is there a way that somebody can come and visit or anything like that within the pharmacy realm?
Very few pharmacies open 24 hours, but there are some. You have to look in your local area or go to the NHS website, and they will tell you the pharmacies in your area that are open extended hours, so that you have immediate access whenever you need it.
So by calling 111, they'll be able to probably guide you in your local
Yes,
area, would they?
111 also have clinicians on site. You actually have a GP, a pharmacist, a dentist, and other people that can support in any condition you need.
Now, like many new initiatives, the 111 initiative had a little bit of a bumpy start,
Yes.
but has that really ironed out now? Are people gaining a lot more confidence with that?
Absolutely. It's all up and running, and it's a very good service to know that's there as a backup as well, especially around 2 o'clock in the morning.
Let's talk a little bit more about these education groups, because we've talked a lot about the different conditions, a lot about the different things where really ultimately good education would mean that people would automatically go to their pharmacist. So what other education programs are you doing to help people really understand all of that better?
Well, in our locality, we're running workshops. These workshops are open up to parents and guardians to come in, and we run them with the health authority, local GPs, so that you can see as a primary care team, we are working together to support patients in the community. Because what we want to avoid is people turning up to A&E with conditions that can be managed at home. And especially in the winter time where viruses are easily spread. So if we can contain them and manage them at home, the patients actually do much better as well, especially children.
So to use an analogy, you might be going out of the frying pan into the fire.
Absolutely.
If you go to A&E, where
That's
actually
right.
at home you can do something a little bit better.
Absolutely.
Tell me a little bit more about you and your background. I'm always intrigued why people go into particular areas of healthcare. And, you know, we saw the kids there, you know,
Yes.
there's that thought of, well, first I want to be a doctor.
Yes.
Where actually a pharmacist has an incredibly important role to play. And as the little girls there said, why wouldn't you want to be a pharmacist? So what made you get into it, and what do you find to be the most satisfying part of your job?
As a pharmacist, as a little girl, I actually wanted to be a pharmacist because I wanted to make a difference to people's lives. And I believe in prevention. A lot of the roles we play as pharmacists in the community is preventative health. So we run lots of campaigns to help people live well. So I believe that if you can prevention is always better than cure. So if you look after yourself, you live well, you won't need to see your doctor because you're living well anyway. So that's why I became a pharmacist, because I wanted to be in a position to be able to be there in the community and help people stay well and live well.
Give me a couple of examples of where you felt really rewarded for your work. Maybe some people who've come to you, maybe especially youngsters who've come to you with their parents, and you've really had that wonderful sense of satisfaction. You've made a difference to their lives.
Oh, there's so many examples of that. We have one little girl came in after helping her. She didn't know much about pharmacy. She stood and watched while her mother explained the condition she was having. Her mother actually didn't want to go to the GP at the time because she had 2 children and she was a single mum, and so she thought she'll come to the pharmacy and see if she can help her daughter without going to the GP. So we were able to help them, and the daughter was so happy. She decided she wanted to be a pharmacist because she thought, oh, there's something healthcare that you can help somebody without going into the depth of being a GP. So there are roles for each of us in the community, and it's looking at what part of that role of helping people that you want to be. I enjoy being a pharmacist because I think...
Clearly, I mean, it's wonderful when we get people on the show who have this passion for what they do. Give me maybe another example of somebody that you've helped and it's given you that sort of wonderful, warm feeling, if you like.
Okay, another customer, we had an elderly man, for example. He actually came returning a blood pressure monitor. He had a long-term condition whereby he monitored his own blood pressure. And all of a sudden, his monitor didn't seem to work. And he thought that something must have been wrong with it. He had returned it twice. But this time, I intervened. I said, no, Mr. So-and-so, let's have a chat. I took him into the consultation room. We had a chat. We tried the monitor on him. It still didn't look right. We tried it on his wife. It gave about 3 different readings, were very odd. And my instinct told me that there's something wrong here. And so what happened, I spoke to the wife and said, look, I think you need to take him actually to A&E. It was a Saturday evening and his readings were totally off the scale and hers were right. So I thought, take him to the A&E straight away. Not to panic him, but let them have him checked. He was admitted for 3 days.
Wow.
You know, and this was just someone that walked in returning the blood pressure monitor. He thought the blood pressure monitor wasn't suitable. And you can imagine, he's my customer for life. He comes in all the time. He reminds me that I saved his life, but I didn't. It was just that gut instinct. We are trained to look out for things. So sometimes there are things niggling going on, and just by coming in to seek a second opinion, especially somebody that is medical, it's amazing what could be found either way.
And the relationship that you have with the rest of the medical profession, obviously there are some pharmacists who work in hospitals, in
Absolutely,
GP
yes.
surgeries and things.
Yes.
How closely do you all work together?
Not to be a politician, but as they say, together we always work better. We do work better together. In pharmacy, there's so many roles now where, because of the burden that's being put on the NHS, people are extending their roles and doing more. So there's so much overlap. So we're all working together better to empower patients and to look after patients. The very key element of all our roles is safety of the patient and making sure people are kept well.
Now, I presume you don't have access to people's medical records online or anything like that. You'll obviously keep your own in-house pharmacy records
Yes.
of what you've dispensed and what advice you've given and so on. Is it helpful if people have a lot more information to give to you when they come to you for potential treatments for minor ailments and things? Is there a way that they can maybe carry that around with them or just have access to that, which would make your lives easier?
As pharmacists now, we can actually access, with permission, you have to have consent from the patient, patients' summary care records. Summary care records are set up by patients' GPs, where they have long-term medication and treatments put on this record. So if, for example, at the weekend or someone's travelling out of their area and they've lost their medication or left it at home especially, as pharmacists we can actually, with their permission, access and find out what they're on and help supply them if their medication's been left at home. So things have changed. The NHS has put so many things in place to be able to help patients all the time.
And that's great, isn't it? If you're
Absolutely.
on holiday or visiting friends and family,
Yes.
and you suddenly need to go to the pharmacist and you can get access
Yes.
to that.
If you forget your
How
medication
brilliant.
at home, that's very commonly happen. People's
Right.
rushing for, if a parent is poorly or if a relative is poorly and they're moving from town and they leave their medication, walk into your local pharmacy.
We're coming towards the end of the show. We're going to do a recap in a moment, but one of the things I want to touch on is some of these extra services again
Right.
that pharmacies do. One of the things that I know I went for fairly recently was for travel injections.
Yes, absolutely.
And things like that. I mean, there's a whole myriad of things that you do. Maybe just recap some of these services, some of these things that people maybe didn't realise you can get at a pharmacist.
Okay.
Apart from travel injections, which I mentioned.
So apart from the both standard dispensing of prescriptions, when the prescriptions come in, we clinically assess the prescription to ensure that the right medication for the right patient is being administered. It's very important that because we are the last person the patient sees, so it's very important that that assessment is made. We also support patients with long-term conditions, especially with blood pressure, diabetes. We help them, monitor their medication, review their medication after some time, and we're good support for when you have questions on your condition. New medicines, when you start a new medicine, there's a service there where we talk you through new medicines. If you're a bit concerned about side effects and what could happen, we talk you through that. We support people with their blood pressure. We can take blood pressure readings, we can do cholesterol readings, we can do diabetic checks, we can support people that decide to stop smoking, we can help with diet and exercise of those conditions. We run sexual health clinics, which are very important. We help prevent people get flu with the flu vaccinations. So travel vaccine, yes, is one of them.
You've done fantastically well remembering all that. Just to wrap up, because we are running out of time now, for anybody who remarkably may still be unconvinced that they need to go to their pharmacy first, what would your final word of advice be?
Pop in and say hello to your local pharmacies. We are there in the community to help you stay well and live well.
That's fantastic. Thank you
Thank you.
so much
Thank you
indeed.
very
It's
much,
been
Martha.
absolutely fascinating, and I will definitely be going to my pharmacist as the first port of call in the future. Thank you very much. Unfortunately, that is all we have time for, but I'd like to thank our guest today, who, of course, as you probably gathered, is a pharmacist. Mary Ohio, she has come into the show and given us some great information, and has also been telling us about the NHS Stay Well Pharmacy campaign. So thanks so much indeed
Thank you
for
very
that. Once again, though, we must stress that should you suffer from any medical problems or health concerns, it's always advisable that you get some contact with your doctor or GP, as the health show only gives you an alternative viewpoint to the health concern being discussed. If you'd like to find out more about this or any of the subjects we've discussed on any of our different programmes, then please do get in touch. You can email us at healthshow@islamchannel.tv. But for now, it's goodbye from me, and we'll see you again next week. Assalamu alaikum.